Hi, I'm Rhonda, I'm a level 1 nursing student. I'm going to be following you today.
Oh, hi, Rhonda. My name is Elizabeth. And I was on my way to get the medication for my patient. My patient is on room 620. Can you please follow me to the med room?
Sure.
Okay, Rhonda. Here's the pixels. So what we have to do first is to compare the level of the drug with the mark.
Okay.
Okay, to the mark. So, and I want you always remember the five rise of the medication, and we have to check the medication 3 times. So this is going to be the first time, okay? So the doctor ordered regular insulin, and like you see here, so we have the right medication.
Okay.
And then the time is 1700, and it's about 1700. So the time is right, and it's going to be subcutaneously.
Okay.
And we have to make sure the expiration date of the medication. So, and it says 2020, so it's good, and the liquid looks clear, which means the medication is good.
Okay.
And we're going to see our patient and ask for the name, and then we're going to compare with the screen, okay? And the computer is going to tell us how many units based on the glucose levels and the sliding scale, okay?
Okay.
So now, let's go and see our patient.
Okay. Can you give me an estimate on the patient?
Oh, yeah. I'm taking care of patient in room number 620. The name is Ryder Kine, and he's a 67-year-old. He has no allergies, is full cold, and BMI is 23.9, and his doctor is Dr. Phyllis.
Okay.
Okay, when he came to the hospital, he was complaining about a non-healing good on the right heel, and he said that he noticed 3 weeks ago, but it's getting worse. And also, so the diagnosis for that patient is stage 2 diabetic also. And he has a history of diabetes type 1, so he is insulin dependent. And the insulin was really high in the 300s in the last week, so we are going to give him insulin to control the hyperglycemia, okay? So when he is not in distress, he is oriented to person, time, situation, and he wears glasses and has a full range of motion in all his extremities. But he was telling me that lately he was not doing exercises, probably because of the wound that he has. And when the nurse in the morning checked her breath sounds, they were normal. So lungs were clear. He didn't have any cough. He didn't have dyspnea, and was breathing normal. Okay. So, and the heart, he had normal heart sounds, S1, S2, no murmur, rap or gallop. And the capillary refill was less than 3 seconds. No edema, no chest pain, no claudication. And when she checked his abdomen, he had bowel sounds up to times 4, and he's on a diet 1800 calories, but he told me that he was not following that diet, and also he requested some information.
Okay.
Okay? And bowel movement is normal, no constipation, no diarrhea. He doesn't have any problem with urination. He is continent, and so his vital signs were at 1645. He has a temperature of 98.4. The heart rate was 76, oxygenation 96, room, and blood pressure 128/70. And he is on 4 medications, so insulin, morphine, that he is getting PRN when he has pain. He requests morphine, and then gabapentin 3 times a day, and Socor. Okay, around 1645, his blood glucose level was 290. Okay, and also he has an IV site on the right median vein, and it's 20 gauge.
Okay.
And the doctor ordered labs, and when I checked the labs this morning, all of them look right, but the calcium is 7.4, so it's a little low. I had to monitor that, and the rest looks good. And the so base, and also I'm gonna give you information about the goon. So it's like 5.5 centimeters length, and the width is 2.5. Okay, so based on all the information that I given you, so my diagnosis is impaired skin integrity. It is related to alteration in sensation, as evidenced by red area, and it has a shallow open ulcer and it's painful. So my plan for today is to clean the ulcer with saline, and the dressing I'm going to be using is a dry sterile dressing, okay, and transfer medication with Ken because he's complaining a little, he's not comfortable, okay? So do you have any other questions for me?
Oh, I have a few questions. Why is the client receiving this medication?
The client is receiving medication because he has hyperglycemia, he is type 1 diabetes, so his pancreas is now producing insulin, and we had to give the medication so to control the glucose levels.
What action does the medication have on the body?
Okay, insulin inhibits the production of glucose by the liver, and also help stimulates the uptake of glucose by the skeletal muscles and by the fat.
Okay. When should you question administering this medication?
I will question if the blood glucose is level in less than 60, because normal levels are considered between 60 and 100. And if it's low, we have to hold the medication.
Does the medication have a therapeutic serum level?
No, it doesn't, but we have to pay attention to the normal levels of the glucose between 60 and 100.
Okay. Which vital signs must be monitored?
The vital signs that we need to monitor are the heart rate, the respiration rate, and the temperature, and also the heart rate and the respiration, the heart rate, temperature, and I'm forgetting all the signs.
Maybe the blood pressure?
The blood pressure, yeah.
Okay.
Thank you for reminding me. Yeah, those are important because if the patient goes in hypoglycemia, he can probably be showing tachycardia, tachypnea. It can be high blood pressure or low blood pressure. So we gotta keep checking those vital signs every 8 hours. Okay.
Which physiological parameters should be monitored when the medication is being administered?
Well, vital signs are very important every 8 hours, and also if the patient is showing other signs of hypoglycemia, like tingling in hands or shaking, and also if the patient has any allergies, it's important.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Oh, I'm going to mention to the patient about the hypoglycemic signs. So if he feels like he's having numbness or tingling, so ask him to please let me know, because those are signs of hypoglycemia.
What interventions must be taught for taking the medication safely at home?
The first thing I'm going to talk to him is about the proper technique for administration. So I'm going to remind him that he has to rotate the sides, and the side has to be spaced 1 inch. And also I will teach him about how to store the medication. It has to be at room temperature. And that he does please don't change any brand insulin brands, because it has to be first checked by the doctor. Okay. And again, the signs of hypoglycemia, and that he has to check his blood glucose 2 or 3 times a day.
Are there any side effects from this medication?
Yeah, the side effect is hypoglycemia.
Okay. Does this medication have any adverse
So
reactions?
the other reaction could be a allergic reaction. Allergic reaction, where the patient complains of itching or redness, or the respiration is kind of difficult.
How will you know if the medication is effective?
I will know if the glucose levels go down. So now I'm going to give the medication to the patient, and in 2 hours I'm going to come back and check if the glucose is going down. That will tell me that the medication is working.
Okay.
Do you have any other question for
No, I
me?
think that's it for now.
Oh, okay. So let's go and see the patient. Okay? So, sing. Oh, hello. How are you today?
I'm good. How about you?
I'm doing good. Today, I'm going to be your nurse. My name is Elizabeth.
Okay.
And I have Rhonda with me. She is a nurse student, and she's going to here to follow me, to observe me, what I'm doing with you.
Okay.
Is that okay with you?
Sure.
Oh, okay. So, can you please tell me your name and your age?
I'm Ryder Kind, 67 years old.
Okay. Yep, I'm going to check. So we need to check the residence with the computer. So in my computer, it says that he's Ryder Kind and the age is 67. So he's the right patient. Okay. So, Mr. Ryder, your doctor ordered insulin this morning because your blood glucose was 290.
Okay.
So, but it has to be done 30 minutes or an hour before a meal is
Okay.
given. So, and I know it's around 1700 and you will be getting your dinner soon. So, and I want to mention about the hypoglycemic sign. So, if you have tingling or you are shaking, you have tremors or sweating, it's important to know that those are hypoglycemic signs and you have to report them.
Okay.
Okay, so I'm going to go ahead and give you your medication, but I'm going to ask you again for your name.
Sure.
Okay. So, Miranda, so now we already checked once at the med room. This is the second time I'm going to do my checking. I'm going to compare my label to the map. So, okay, yes, check on me. We have insulin, regular insulin, and then we have the time is 1700, and it's gonna be given subcutaneously. And also, we already checked the expiration date of the medication. We check and verify that the patient is the right patient. So, so this is where I'm going to enter the patient information, okay? So can you please tell me your name and your age again?
I'm Ryder Kind. I'm 67 years old.
67. Okay. So we don't have the scanners. I'm going to enter that. Do you have any allergies?
No.
No. Okay. I'm going to check on the computer. Yeah, and the computer also said that you don't have any allergies. Okay.
Cool.
So I don't have the scanners. I'm going to enter the numbers that I have here. Rhonda, you know my yes, please.
686 764
7,
764
6, 4. Okay, that's it?
560
5, 6, 0. Okay.
7.
7. Are you sure? Yeah. Okay. Okay, so now I'm going to scan the medication.
Okay.
So can you please read the numbers for me? So,
D9, D9, C9, C8, 7B, 9E, 0B,
A4.
A4. No, A4, not 8. A4.
Oh, the letter A?
Apple. Yeah.
Oh, okay. This is very important to see the green line because the light is telling me that it's the right patient and needs the right medication.
Okay.
Okay. So we have that, and we have to check one more time. I'm gonna prepare the medication, but this is the third time I'm gonna check the medication. Okay. So we have the regular insulin, we have the 1700 at the time. We already verified the patient name, and it's gonna be given subcutaneously. And we're not gonna miss with anything. But in case it's another medication and we don't know if it's gonna be crushed or mixed, then we have to call the pharmacy. But in this case, no. Okay, and the dose is gonna be based on the sliding scale that you can see here. Okay. So you see here, the patient had 290 glucose level, and it says that from 241 to 300, the patient should receive 16 units.
Okay.
So which is correct, okay?
Okay.
So, Mr. Riley, do you have any concerns about the medication given subcutaneously?
No.
Okay. I'm going to put the top of this vial to prevent contamination, okay?
Okay.
So it's 16 units, so I'm going to have 16 units of air so to facilitate when I withdraw the medication.
Okay.
Okay. So that's that. You see 16 units? Okay. So we already checked it was the right medication, the right dose, based on the sliding scale. Sorry. One thing that I had to remind you is that never cut the syringe.
Okay.
So I was going to make a mistake. Thanks God I remember. So we use this technique.
Okay.
Okay. I know sometimes it's difficult, but okay. So the medication. And then, Mr. Ryder, you can receive the medication on your abdomen or your arm.
The abdomen's fine.
Okay.
I did,
So
the
just
last one was on the left side.
on the left side, so now you want on the right
Yeah.
side. So remember to rotate the sides, it's very
Yeah.
important.
At least
okay?
1 inch.
Yeah, at least 1 inch apart, okay? Okay, so he said prefer the right size. And a little the alcohol to dry a little bit. So it's 90 degrees because it's subcutaneous. And then this goes to the needles container. So, cancer. So, Mr. Ryder, are you doing okay?
Yeah,
Yeah? No pain? Nothing?
no.
Okay, good. Can you please tell me the signs of hypoglycemia that I discussed with you?
Yeah, I need to be aware of if I get like tingling sensation in my hands and feet, my lips, if I'm like nauseous or I got chills. Then I need to like check my blood sugar or call the doctor.
Yeah, that's important. Okay. So, and then the mark, you say, I checked that you requested information about diet.
Yeah, because I haven't really been following the right diet.
Yeah, that's what I thought. So I printed some information for you so you can have it, and I'm going to be back and check it in about 2 hours. So you have any question, we can discuss those questions.
Okay.
So I'm gonna document now the time I give you the medication. So we have to document the time the medication was given, and we had to enter here where we the injection. This guy was in the abdomen, right? Abdomen, and it was the left. It was the right side, right? And also we had to enter the blood glucose levels, which was 290. It was, we gave the patient 16 units, right? And the patient tolerated the medication. So, and I'm gonna enter also the news. Do you have any questions for me?
No, I'm good.
Oh, okay. So I'm gonna give you your call light.
Yep, I got my call light
you-
right
you-
here.
Yeah, it's very important to have it by your side. So if you need something, just put the button and I will be here.
Okay.
Okay, do you have any other questions
I have
for
a few
me?
more questions. Were there any pertinent pieces of information you reviewed before administering?
Yeah, I checked the blood glucose levels and it was high.
Okay.
So that's it. And the allergies also, the patient said that he doesn't have allergies, and also the computer said the same thing.
Okay. Did this information affect your decision to administer the med?
Yes. The blood glucose level was high. The patient was on hyperglycemia, so the patient needed the medication.
Okay. Did this information affect how you administered the medication?
Well, in this case, the doctor ordered the sliding scale and the route were appropriate for the patient.
Okay.
So we checked that and everything was fine. Do you have any other questions for me?
That's it. Thank you so
No?
much.
Okay. So